Hello everyone, this is me Sidratul Montaha. Once again, welcome back to Do It in the Dark. In this video, we will cover the basics of the uterine fibroid, what is it and who gets it, the symptoms, diagnosis and treatment. Let's start the video. First question is this: are uterine fibroids are benign or malignant tumors? Uterine fibroids are basically benign tumors and they are arising from the myometrial cells or muscles. We all know uterus is made up of three layers: endometrium, myometrium, and perimetrium. That one myometrial cell, now it's undergoing rapid division because of certain mutations, and it is forming the fibroid. As you can see the picture on the screen, they may also grow in the fallopian tube, cervix, or tissues near the uterus. Now, look at the symptoms of uterine fibroids. Most people with fibroids don't have symptoms at all. They often found unintentionally during a routine checkup. I mean, fibroids are asymptomatic sometimes. In some patients, if a patient does have symptoms, heavy prolonged or painful menstrual bleeding is a common problem. Periods that last more than 1 week cause soaking throat pads. Large clots are also considered abnormal. If a fibroid gets very large, they can cause your belly to bulge like a pregnancy or compress nearby organs, causing constant pelvic pressure, frequent urination, or difficulty passing bowel movements. In some cases, fibroids can make it harder to get pregnant or cause problems during pregnancy or childbirth. If you are experiencing any of these symptoms, then take to your doctor. What are the causes of uterine fibroids? Exact cause of development of fibroid remains unknown, but some purpose that the cause can have genetic tendency. It can run in families and it can also be caused by changes in growth factors, which are proteins involved in the rate and extent of growth of cells and tissues within the womb. It can also related to abnormalities in the vascular pattern and vessels in womb. Fibroids can grow anywhere in the womb and vary in size, and places where it grows it can be vary between a peach size and a melon size. Now look at the types of fibroids. Fibroids can be located in various parts of the uterus. This is the picture depicting different locations of fibroids. Most common fibroids are subserosal fibroids, intramural fibroids, submucosal, pedunculated, cervical fibroids, and calcified fibroids. Subserosal fibroids, which develop under the outside covering of the uterus and expand outward through the wall, giving the uterus a knobby appearance. The subserosal fibroids can develop a stack or stem-like base, making it difficult to distinguish from an ovarian mass. These are called pedunculated fibroids. The correct diagnosis can be made with either an ultrasound or magnetic resonance exam. Submucosal fibroids, which are just under the lining of the uterus, they are the least common fibroids, but they tend to cause the most problems. Even a very small submucosal fibroid can cause heavy bleeding and prolonged periods, as shown in the picture. Now look at the intramural fibroids. Intramural fibroids are the most common fibroids. They develop within the lining of the uterus and expand inward, increasing the size of the uterus and making it feel larger than normal in a gynecological internal exam. So, how to diagnose the uterine fibroids? The diagnosis of uterine fibroids involve a pelvic examination. If your doctor feels an irregularity in the shape of the uterus, or if you come in with symptoms, they will probably order a diagnostic ultrasound and other imaging modalities such as MRI or CT scan may be employed. In my next video, I will discuss the ethnological findings of uterine fibroids and its types. Hope so you guys like it. Take care and stay connected for more updates.